Lamaze here. We're going to spin the wheel of birth and see what topic we're going to talk about today. But I wanted to let you know that we have over 50 other topics, and you can find them very easily because they've been organized into a free course at birtha2z.com. Check that out and see what you think. Let me know. Okay guys, let's spin. Okay, today we are talking about GBS. So GBS stands for Group B Streptococcus. So GBS is a bacteria that can live in your gut, can live in your intestines, can live in your vagina, and it's something that actually 1 in 4 women carry the GBS bacteria. And it's also something that can kind of come and go in our bodies. And the crazy thing is that we have no symptoms of GBS. So as you are getting late in pregnancy, your provider will likely test to see if you have GBS in your body. Now, this test is usually done at an appointment during your 36th or 37th week of pregnancy. And what it is a swab that is done usually in your vagina and around your anus. So it is not something that you have to have a vaginal exam in order to be done. It is just a swab on the exterior of your body, or maybe slightly within or slightly inside of your vagina. And with that test, they can tell whether or not you are what's called GBS positive. So usually before your next appointment or at your next appointment, you will find the results from the GBS test, and you'll be told whether you're GBS negative or GBS positive. So if you are GBS negative, it means that the GBS is not in your body at the time of the test, and so that you will not be treated for this bacteria when you are in labor. If, however, you are GBS positive, then the protocol that most U.S. care providers do is that they give antibiotics during labor. So that is actually antibiotics that is run through an IV, and the antibiotics can take anywhere from 15 minutes to an hour to run all the way through for the whole amount of the bag of antibiotics to get into your system. It depends on the speed at which they're dripping it. And that antibiotics will be usually re-administered about every 4 hours in labor. So if you are there for 12 hours, you might get 3 doses of antibiotics. So I'm going to check the CDC super quick to give you guys a few numbers. I'll be right back. Okay, back from the CDC website, a couple pieces of information I think is interesting. First of all, GBS is pretty common. 1 in every 4 people are carriers for the GBS bacteria. So 1 in every 4 people giving birth will be tested and find out they are GBS positive. Now, another set of numbers which I find really interesting too is that if you are GBS positive and you're treated with antibiotics at least 4 hours prior to delivery, that your baby has a 1 in 4,000 chance of developing GBS disease. Now, GBS disease is what the antibiotics are supposed to be preventing. So antibiotics, if given, it's 1 in 4,000. Now, if antibiotics were not given in labor prior to delivery, then the baby's risk of infection is 1 in 200. So it does increase significantly if antibiotics are not given prior to birth. As a doula and a childbirth educator, I get the question a lot. How do I get GBS out of my system? And unfortunately, the answer that I'm going to give is you can't. Now, there's wives' tales, there's different people that have tried different things of eating more probiotics, there's some garlic situations that have been described, but there's really no surefire way of eliminating GBS from your body. So that is the info about GBS, and I hope you found this information helpful. That's really the goal here, is to make these quick little childbirth ed nuggets so that you can get right to the information you're looking for on the topic you're looking for. So hit the like, hit that thumbs up like if you like the video, subscribe, and hit the notification bell if you want to see what the next topic is on the Big Wheel of Birth. Bye guys, have a good day.